I want to say thanks to the audience for still hanging around on a Friday afternoon. So thank you. So my declarations, I have received some honorariums from GSK for immunisation education sessions for GPs. Learning objectives are there, so hopefully we achieve them by the end of my talk. So I had a little case study to start the discussion. And interestingly, this patient just recently had RSV and had come in really wheezy and not known to be an asthmatic. So interesting that we're all talking about RSV, but back to the discussion about pregnancy. So she was a young first-time mum. I'd known her for a long time, but she'd been living out of town. She came back to me to tell me she was pregnant with her first baby. And while we were doing her physical examination, we discovered two small cancers. She also, at the end of the consultation, revealed that she had an AODS issue that was leading to lots of psychosocial issues, and obviously being pregnant, she wanted to get that sorted. Amazingly, I made the phone call and got her an AODS appointment the next day, and she's remained abstinent since, which is fantastic news. As you can see, general practice is a busy space. We've all talked about it. There's a lot of pressure on the health system for everyone in the health sector. We're all overworked, underpaid, in my opinion. That's a picture of my desk. There's a million guidelines on it. There's a million item numbers for COVID numbers that we have to remember in general practice. It's just a busy, busy workspace that we work in on 15-minute appointments. And yet we're expected to meet every guideline, and we're expected to do our best for our patients sitting in front of us. Primary Sense is a digital tool that did save me in this situation, because naturally we had lots to talk about every time this patient came in. And when she reappeared around 29 weeks, she hadn't had her vaccinations, and the Primary Sense prompt popped up in front of me and brought it to my attention that she wasn't up to date with her vaccinations, even though we'd mentioned it and suggested that she go out to the nurse to get them. So when things aren't done, there's always system errors, being overworked and overstretched. There's human errors where we might tell our patient to go and get their vaccination, and we assume in our head that we've done it, but they don't necessarily follow through. And then there's doctor factors where we go through a million different things in our head when we're seeing our patients, and we might forget to mention it. So hopefully digital tools will be part of the solution to improving immunisation rates. So what is Primary Sense? You've heard me mention it today. It has many different facets to it, which means that it's really useful for general practice, and it has different appeals to different settings and different general practitioners and nurses. It's a data extraction tool. It takes de-identified data every 3 minutes. So it's up to date, and it's uploaded into the PHI, the Primary Health Insight cloud-based secure system, so that it's well governed and it's secure. It allows the data analysis. So rather than just having generic prompts, it's filtered. And I like to say it only pops up like toast when it's ready. So I don't want my toaster popping up too early. I don't want it popping up too late. As a GP, I'm too busy to have generic prompts because I'm just going to ignore them. And I'll show you an example of that on my screen later. So it only will pop up if the patient sitting in front of you needs that intervention as per the database algorithms. It's decision assist. So as I go to prescribe, it'll give me some decision assist information around things like immunisations, healthcare planning items, medication alerts, that sort of thing. It assists with care planning. So if you've got a new doctor starting, you can get them pretty much up to speed with patients straight away by being able to give them the previous doctor's patients, being able to hand over patients at risk, being able to close those gaps like immunisations that are outstanding. It allows care optimisation. So we all know the guidelines for immunisation in general practice. As someone previous said, it's not rocket science, but it's how we translate that evidence into practice with the patients that are coming through every 15 minutes. So this tool helps us in that space. It allows care reviews. So for things like health assessments, when we're bringing them in for those over 75 checks, it can tell us who's not up to date for their immunisations. It's currently in 11 out of the 32 PHNs, around 31 PHNs around the country. It covers all of Western Australia, all of Northern Territory, North Queensland, Sunshine Coast, all of Southeast Queensland, 2 down in New South Wales and Sydney, Nepean Blue Mountain and North Sydney, and all of Tasmania. It means that we're getting 13 million unique identified patients uploaded every night. So it's covering about 58% of the population. So you can see the power of being able to train this tool to prompt us with new guidelines. It's really hard as GPs, even if you're vaccine aware and vaccine acceptor and a vaccine promoter in your practice, it's really hard to get your head around all the new schedules as they come online. So this tool can be trained to push those notifications out. It allows risk stratification. So it's worked on the ACG tool, which is the Johns Hopkins tool. It's been around for 20 years and it's been in 30 different countries. And it means that we can risk stratify our population. So we can pick out those most at risk. We can pick out our patients that are 80% likely to go to hospital and make sure that we do wrap those winter wellness immunisations for them. It means that we can be equitable in our care. So rather than just treating the patients in front of you, it means you can look at your whole population, and those patients that are missing in action, you can find them and you can bring them in. It helps with the whole team working together in a structured way, and it helps with the business flow of general practice. So it was developed with the Department of Health Innovation Grant. It had a lot of input from GPs, practice managers, pharmacists, practice nurses, and PHNs, and it's been designed to work with the workflow of primary care. So GP can get a medication alert at the time of prescribing if, for instance, the EGFR drops low. It can share de-identified data across practices that are linked. So if you own a chain of 10 practices, you can share that data already across all the practices that you own. We'd like to get permission through the Privacy Commissioner to be able to share immunisation data. It's there on air. It's a pain, it takes time, and it's a waste of resources to download that separately into our immunisation records in our practice software. So if we were allowed to turn that on, we could share immunisation data amongst those 13 million unique identifiers. GPs get prompts on missing immunisations as they open the record, as they're about to talk about something else. Winter wellness reports can be downloaded by your nurse, and you could have a structured immunisation clinic, and you can target it. If you've got a brand new nurse starting, you could give her the patients that you know had the flu shot last year, so you can target it to that sort of level. If you've got a nurse who's really experienced at talking, communicating, or a GP that's really experienced at communicating about vaccine hesitancy or patients that are unsure, you could target that population to that person. It allows you to pull the antenatal report and find those that are missing their pertussis and missing their flu shots with a click of a button, and it takes a minute or two to download. When I did that as my RSCGP audit this year, sadly, there was only 2 on it that weren't fully vaccinated, and they were both healthcare workers. Oops. Luckily, one had it, hadn't recorded it. It was on air, so I downloaded that, and the other did have it. So yes, it's nice to get to 100%. The evidence for it is published in an RSCGP article. So if you're so inclined, you can look it up and read it later. Take-home message was this was during pandemic. This is from January 2021 to June 2021. It was while we were busy rolling out the COVID vaccine. They hit our shores 23rd of February and hit most general practices and big clinics around March. And we found with no training, with the COVID environment, with a pandemic, GPs acted on 20% of their prompts. Those that were due for influenza that were in risk band 4 and 5 are the ones that are the multimorbid, comorbid, diabetes, heart disease, kidney disease. We got them up to 72% in our PHN. So pretty impressive during that really busy work phase. We got our antenatal pertussis vaccinations at that point at 47%. There was a bit of hesitancy around the COVID times for our antenatal patients coming in. Since then, we're seeing around the 80% mark. That's just a little bit of an idea of what it looks like on a GP desktop. This is a best practice desktop with our fake patient, Robin Town. I work at Robin Town Medical Centre. And you can see all the green best practice ones are just generic. They don't really have that filterability, so GPs tend to ignore them or just delete them. The prompts for primary sense pop up in your face. They last about 3 or 4 minutes. You can minimize them if you want to. You can ask for more time if you want to. If you're too busy that day to do it, you can say, remind me next time, and it will keep prompting you till you get it done. It also allows you to say, not appropriate for this patient. You know, if someone's palliative and they don't want to have a flu shot, you can just tick that box. It allows you to look up more info on whatever the prompt is, so we can link directly to things like the NCRS resources and the Sky resources. There's a multitude of reports that GPs can pull down, or practice nurses or practice managers. and it allows them to look at things like pregnancy vaccinations that are outstanding. There's a new report there for childhood immunisation, and soon we're going to have childhood prompts. There's the ability to do QPIP, and there's the ability to do CPD and clinical audits. Under the clinical audits, you can pull out your children that have got high complexity. So often you assume that kids wouldn't be in that risk band 5 and 4, but obviously if they've got cystic fibrosis or cardiac disease, they may well be in that high complexity status. That's a bit of a look at what the report looks like for your pregnancy vaccination reports. You can search by doctor, you can search by who hasn't had vaccinations, you can search by who has had vaccinations, and you can search by when the next appointment is due with the doctor. So you could just add a nurse appointment. So it just helps with all that streamlining, that ability to make it easy to deliver vaccines and the ability to make it convenient for our patients that are accepting. There's winter wellness immunisation reports you can pull. So you can pull those patients that are indicated for any of the winter wellness vaccines. It can be exported, so you can SMS it to patients to be able to recall them, to be able to get them back for their vaccines in for like a mass flu shot clinic or a COVID clinic or a Prevnar clinic. So you can use that for your work streaming. That's just the vaccine fatigue data that we have pulled from 10 PHNs, showing the blue bar graph is 2023 and the orange bar graph is 2023. 2022, sorry, is the orange and 2023 is the blue. So we are noticing that drop off. But again, it's a little bit hard to know how many of those are being done in pharmacies. And we did see from the previous talk today that those numbers are increasing. So hopefully we are getting more coverage. Some GPs will record that the vaccine's been done elsewhere, and then it will be able to be extracted. But we really want some more digital solutions so that we're not all reinventing the same bit of data and reinventing that work. I always say that if I can save 1 minute at the beginning of my consultation, not having to check my vaccination status for my patient, you multiply that throughout the day, that's 30 minutes, that's 2 or 3 more extra consults for a GP. That builds work sustainability, builds work economics, and it really does mean that we're not reinventing data extraction. As I said, the childhood immunisation report is available now, and we'll use that to do the prompts. It'll be in those colours, so you can easily see which of your patients that you can search by doctor alone are overdue vaccinations and get them in and make it really streamlined. So you can see this is our fake patient, Robin Town. He hasn't had any vaccinations. He's very naughty. He needs to come in. But you can do that, and you can see if someone hasn't had any, you know that you're going to probably need a longer consultation to be able to have that time for communication. So it just allows that work streaming process. Oops. We've got Men-B prompts that just went live beginning of this year with the Queensland rollout of the free meningococcal B. So it's just emerging data. Also at the same time, some PHNs were rolling out Primary Sense. So we know that the data's in its infancy, but we hope by the end of the year to be able to have a much better idea of how that's working with a prompt for doctors to remind them to discuss meningococcal B with their patients now that it's funded. We will then be able to hopefully compare it with other PHNs where it's not funded and see that effect of what funding has done to the numbers of Men-B immunisation uptakes. I always say to everyone when we're talking to doctors, it takes many different hooks to catch a fish. So some people are motivated by good immunisation rates, like myself doing the audit. I think that was good to be able to find, yeah, I am on point. But other people are motivated by business. So you could do your business outcomes to be able to translate evidence into practice and say, yeah, it is worthwhile doing a flu shot clinic if we can get a mass number here, get them all here on whatever time. It is also useful to be able to do your CPD audits in a seamless way, touch button. We were talking about that before. It's a nice way of being able to promote immunisation, and Primary Sense has the CQI activity built into it for immunisation. We showed 40% uptake if a GP had a desktop for the highest risk in influenza vaccination delivery last year. So that's an extra 40% of people that were highly at risk of going to hospital if they caught flu covered. So I think this does speak to the value of prompts. Only thing I want you to take away from that slide is over 17 million patients have been assessed for risk related to a prompt in the last 12 months. So you imagine if we train this tool to roll out, for instance, pneumococcal immunisation algorithms, that's 17 million people that we are pushing that education out to via their GP or their practice nurse or the practice team. We can build AI into the prompts so we can see how GPs respond to them. And, we could play with that, GPs or nurses, and we can see whether or not the prompts are working and whether the doctors think that they are appropriate. So in summary, we know that targeted point of care prompts do work, and it lifts 40% the most at-risk influenza immunisation rates. We can use it to find those patients missing in action that are of high value to vaccinate. It's able to look at population trends, so we can look across the population at what is happening. Digital tools do drive efficiencies and outcomes. Healthcare providers do need to code data, so it would be another thing to say, go back and tell your practice to keep coding. And we need GPs to have more of these sorts of tools on their desktop. So this is some of my list of blue sky thinking, but I'd be interested later to get your opinion on any ideas you have for things like digital tools like this to improve immunisation rates, and anything you think that we could do, please email me.
Thank you for that wonderful talk. Lisa, is this available with all desktop programs or just best practice at the moment?
Best practice and MD.
Best practice and MD. Okay, so I think that's
the majority.
that is a really exciting development. We probably have time for one quick question.
Can I have it?
Yep.
Okay, I've just got a question. The immunisation data, is it what's in the provider's computer or is it direct from air?
So it's only at this stage what's in the provider's data. But like with smoking, we found that because you get prompts that aren't appropriate, like you get a prompt saying your patients are high-risk cardiovascular patients, so it goes just makes you change them into being an ex-smoker. This is also changing doctors into just pressing that click button. It takes 1 second. Once you're there to check it, right-click it and it goes into your record, then it's extractable.
And will it do the HPV or is that
Yeah,
coming?
it can.